welcome to this session this evening, which is giving an overview about, very briefly, the school's white paper, but our main focus this evening is about the SEND consultation. We're delighted that you've all joined us. If I could just do some introductions as to who is here speaking and managing this session this evening, then I'll go on to the purpose of the session and how we're going to run it, and then I'll get started. So my name is Sharon Smith. I am the Policy and Parliamentary Lead for the Down Syndrome Association, and I'm joined on this session this evening by Gillian Bird, who's our Services Director from the Down Syndrome Association, and also Philippa Stobbs. And I will let Philippa introduce herself, if that's okay, because I don't want to get it wrong. Philippa, could you introduce yourself as to your capacity for speaking this evening?
My name's Philippa Stobbs. I was until relatively recently one of the associate directors at the Council for Disabled Children. Since my retirement just a couple of years ago, I've continued to work on SEN and in particular on disability issues.
And you're here in that sort of independent consultant capacity this evening, aren't you?
Absolutely. What I'm saying is not determined by my role at the Council for Disabled Children. Thank you, Sharon, for that prompt.
No,
Important.
I just wanted to clarify that and make sure that everyone was clear on that,
Thank
which
you.
allows you obviously to speak clearly. And we're very grateful to you for giving up your time to come and join us and for us to be able to access your vast expertise and to hear your thoughts on the reforms. So thank you very
Thank you
much,
for
Philippa.
inviting me, Sharon. Thank you.
So the purpose today is very briefly to introduce the school's white paper and to summarise the SEND consultation proposals. We're wanting to explore some of the implications for learners who have Down syndrome, maybe talk about some of the risks and opportunities that are inherent within the proposals, but also to hear from you as professionals who are supporting learners who have Down syndrome, whether you're working in education, health or social care, or if you're in the voluntary sector. And we've got an opportunity as well for you to ask questions of myself, Jill, and Philippa too. And if we can't answer them, we will be able to come back to people afterwards. So in terms of the session, it is being recorded and we will put this on our website and YouTube channel. So if you don't want your face to be on the screen, then please feel free to turn your cameras off. It's completely up to you whether you have your cameras on or off. I think the chat is disabled, but I'm not 100% sure. I'm now more used to using Teams than I am Zoom. But the intention is that we'll use the Q&A function during this session. And if you can't see that within your screen controls, it's possibly under the button that says More with 3 dots. If you click on that, hopefully you'll be able to see it. That's just so that, given that there's quite a few people on the session, it means that we can answer questions and be able to respond. Depending on how the session runs, there might be an opportunity for us to actually come off mute and have a bit of a discussion at the end, but this is only running for an hour. And if we do that, we won't record that part of the session so that you'll be able to speak freely. But what I would say is you can email any feedback, any thoughts you have around the consultation, around some of the proposals to me at the email address showing, if you want to contribute to our response from the Down Syndrome Association for us to consider your thoughts on that. So I'm going to go through these slides really, really quickly because I think what's more important than hearing me is to hear Philippa's views this evening, but also for an opportunity for you to ask some questions and for us to have maybe a bit of a discussion. So the school's white paper is broader than just SEND reform. It sets out the government's long-term plan for schools in England. So this is England specific. It develops and proposes reforms across the whole school system, including raising attainment, looking at attendance, improving disadvantage funding, increasing collaboration with families, reviewing and hopefully improving admissions processes to make them fairer and more equitable, and also strengthening the school workforce. There is a big push within all of this to improve mainstream inclusion. And it's set in a 10-year direction. So all of this is a 10-year plan. It's not things that are necessarily going to change things next week. Well, then it's not going to change some of the things next week because there's a consultation going on. But this school's white paper really sets the context within which the SEND reforms are being consulted on. So in terms of those proposals for children with special educational needs and disabilities, what we're seeing is, as I've said already, a big push and focus on mainstream inclusion. The government wants to see more children, wherever possible, being educated in mainstream settings. And that may be that they are in mainstream classrooms, or it could be that they're in inclusion bases that are within that mainstream site. So a lot of what's driving the reform here is about having children in their local communities being able to go to the same school as other children from their local areas. They're proposing new tiered layers of support in mainstream education and also with specialist provision, and introducing individual support plans. There's proposed changes to education, health and care plans, and I'm going to come on and talk about all of these very quickly. New funding mechanisms, new accountability structures. They're proposing some restrictions on parental preference around placement, proposing changes to the SENDIS tribunal powers, and also have said that there will be a revised code of practice and also Ofsted inspection criteria. And again, Ofsted have already started to look at how they can assess how inclusive schools are. The consultation itself closes on the 18th of May, so we've got about 4 weeks for us to respond to it, for you to respond to it, and we would encourage everybody to respond, even if you only answer a few of the questions, and also if you feel that the questions aren't necessarily saying or giving you the option to say what you need to say, you can either answer in question 9, which seems to be a bit of a catch-all for everything, or we would recommend that you just put the content into the closest question for what you're wanting to say. All of the consultation documents are on the government website, but we have a page on our website. If you go to our website and type in schools white paper, then we've linked to all of the key documents, and that includes easy read, BSL versions, and links to the online forms. The responses to this consultation will inform the government's final proposals, and there are quite a lot of aspects actually that are still quite unknown within the reforms, and I'll touch on some of them as I go through this presentation. But we do encourage everybody to respond: families, young people, professionals, organisations, and people working in the sector. So this is a big fundamental shift in terms of pupils who have special educational needs. They're wanting to see more children, as I've said, being included and educated in a meaningful way in mainstream settings. So to support this, they are proposing that there will be some national inclusion standards that are developed that are based on evidence, which set out almost a sort of minimum provision that all schools should be providing. But also they're talking about that being as well a bank of resources where there are strategies and tools that schools can use as well. So there's 2 parts to these national inclusion standards in terms of the DFE's current thinking. They're wanting mainstream schools to demonstrate inclusive practice, and they must publish an inclusion strategy to show how they're going to become more inclusive. And there is also a greater focus on the Equality Act duties as well, including making reasonable adjustments for disabled children and young people. As part of these reforms, they're proposing some changes to the specialist sector too. They're saying that special school places or places in Inclusion bases potentially are only going to be for those with the most complex needs, for children who have education, health and care plans. Complex needs hasn't yet been defined. Again, that's one of the things that the DfE is looking for input on, and there are a number of definitions about what complexity may or may not mean. We don't know yet whether children or all children or some children who have Down syndrome will be considered as having complex needs. They're looking for greater outreach into mainstream school from specialist settings and also alternative provision, so put AP there. And for, as I've said, more specialist places to be delivered in mainstream settings. So alongside the mainstream classrooms, having more inclusion bases, and they've said that every secondary school needs to have an inclusion base, and they're moving in the future to looking at how primary schools can have them too. And then they're proposing reform around independent special schools in terms of aligning duties with state special schools, introducing national funding bans, wanting to ensure value for money and greater transparency. So this is to try and prevent those settings in the independent sector that are making a lot of profit out of this system. So I mentioned briefly new layers of support. They're proposing 4 layers: universal, targeted, targeted plus, and specialist. And we would imagine that most children who have Down syndrome will fall into specialist, potentially targeted plus. We're not really sure at the moment because there is not yet clear delineation between those different layers, and I'll come to explain why that is at the moment. So where it says specialist, that doesn't necessarily mean that those children are going to be in a specialist setting. What it means is that they will have a specialist provision package, and the DfE have confirmed to us on several occasions that there will be specialist provision packages for children who have more complex needs who are in mainstream school. And their overarching intention, as I've said, is to have more children educated in mainstream schools. So this is an area that they are really keen to be developing and working on as to what do those specialist provision packages need to look like to support children who have more complex needs within mainstream settings. So that might be something that, excuse me, some of you might want to include in your responses to this consultation as to what does it look like for those specialist provision packages, and I'm going to talk about those a little bit in a second. And they're anticipating and expecting schools to collaborate with other schools locally, and for schools to be part of either a multi-academy trust or a local trust. And they've said local authorities will be able to set up their own trusts for schools that aren't yet in a trust if they're maintained schools, so currently led by the local authority. So in terms of EHCPs, and partially the reason I'm going through this really quickly is to allow Philippa to go into some of the nitty-gritty and the detail and the implications. So please forgive me for the speed I'm rushing through this. They're suggesting that there will be new thresholds for an education, health and care needs assessment. We currently have a long-standing legal definition as to when a local authority should undertake a needs assessment, but they are looking to redesign that needs assessment process and potentially the criteria as to who should have one of those assessments. Excuse me, I've got a tickle in my throat. There's going to be the introduction of national expert-led specialist provision packages for those with the most complex needs. And it is whether a child is likely to need provision from one of those specialist provision packages that will determine whether they're going to have an education, health care needs assessment. At the moment, those provision packages haven't been set out, so it's really hard for us to see which children will be entitled to a needs assessment and which children won't, and also how any of that is going to be determined in practice. So that's one of the areas that's still a really big unknown for us. So as I've said, there'll be a new needs assessment process that needs to be designed. Alongside education, health and care plans, they've said that every child who has special educational needs will have an individual support plan. These are going to be written with the school, and they're going to specify the day-to-day support. So you will have potentially a child will have an education, health and care plan as they might do now, but the day-to-day provision that is currently specified in section F of that EHCP is actually now going to be specified in a school-led individual support plan. And that means it won't be appealable to the SEND tribunal. So for families, they won't be able to take that and say, I don't agree with that content, and they won't be able to take that to tribunal. All they will be able to do is go through the school's complaints process. And they are proposing that there will be an enhanced schools complaints process where if you're not satisfied with the school's response, it will be escalated up to a panel that will include a SEND expert, maybe a SENCO from another multi-academy trust. They're proposing that the ISP and the EHCP will be digitised to allow people greater access, but also transferability, and they will be standardised. And they're also talking about having a fast track for children under 5 who have identified complex needs from an early age, so that they won't have to go through the whole process of applying for a needs assessment. Instead, they will be given the education, health and care plan and allocated the provision packages that that child needs. Based on the provision package that the child has been assessed to need, the local authorities will then provide a list of settings that they have commissioned that will be able to deliver those specialist provision packages. Now, again, how this works with mainstream schools, we're still not sure, because they're unlikely to commission every mainstream school to deliver specialist provision packages for all of the 7 different packages that they're intending. So I think there's still quite a lot of thinking that needs to be done about what this looks like for inclusion. So those packages are being developed. They are being developed by experts. There's an expert panel that's currently being recruited. Tom Rees is heading that up. He's one of the 2 co-chairs. There'll be another co-chair who's recruited from health. And these packages are meant to reflect children's needs, and they'll be tested with both professionals and parents and reviewed regularly by the independent expert panel. And these are the 7 packages that are currently proposed, but there is no real detail as to what will be within them. Now, what we were told the other day in a meeting we were in with the Department for Education is that things such as speech and language therapy are likely to be within each of the 7 packages. So although there's a package, the 3rd one on the list, that talks about communication, you don't have to have eligibility for that to receive speech and language therapy. So each of them will have certain aspects, certain levels of provision, and that's what will be commissioned by the local authorities. We've also been reassured by the DfE that at the moment we have provision that might be classed as social care or health, but it educates, so it's classed within section F of an EHCP, and they've said that that will be maintained. So it will still be classed as education provision, even if it is something that might be delivered by health or social care, as long as it's educational or it trains. So that will remain. Talked about the individual support plans very briefly. As I've said, every school will have a duty to produce these for every child who has special needs. They'll be developed with the parents, and this is where provision now will be specified, and these will be reviewed annually with the school. It's important to note the education, health and care plans they're proposing, they're only going to be reviewed at key transition points. So, for example, when a child is moving from primary to secondary or secondary to post-16, again, you may have some thoughts on that in terms of those child's needs and how they might change during that period of time. For example, between year 7 and year 11, young people change quite a bit. So complaints about ISPs will be through the school's complaints process, and potentially there may be more judicial review claims against schools or disability discrimination claims. They're also looking to introduce experts at hand, which is for that targeted plus layer, where there's multi-agency teams advising schools. This may be education psychologists, specialist teachers, speech and language therapists, OTs, etc. Every local area is going to need to define their exact expert at hand offer, depending on the resources that they've been allocated. The government last week set out what each local authority area will get for their first tranche of money. And these expert at hands are not to provide direct therapy to children. So this is not about them saying, well, there's a speech and language therapist who's going to deliver therapy to that child every week. Instead, it will be about them being in the classroom, advising and supporting teachers, upskilling people in the school to deliver therapeutic support rather than that direct therapy. And this is intended to enable quicker support for children who need it without them having to go through that education, health and care needs assessment. I've already talked about inclusion bases, so I'm going to skip through that slide. And then just two more slides from me, and I'm going to hand over to Philippa. There's some proposed changes that are quite significant to the SENDIS Tribunal. So you will, as a parent and a young person, be able to appeal to SENDIS if the local authority doesn't conduct a needs assessment and you disagree with that decision. They will also be able to make binding decisions about those specialist provision packages if, say, you disagree with which package your child has been allocated to, and also those annual reviews. They're not going to be annual reviews, those transition period reviews of education, health and care plans. There's going to be some changes in terms of when a local authority can decline a parent's request for a particular setting based on financial reasons or if the setting is full. And tribunals will no longer have the authority to name a specific setting, which they currently can do. All that will happen is they will say that the local authority has to go back and reconsider its decision. Now, education, health and care plans are not going to be written until the setting has been agreed. So we could end up with a situation where there's a bit of a doom loop and you keep going round and round until the setting is agreed because the tribunal can't agree or name a particular school. And then just the last thing from me is there is a phase transition proposed. The recording will show this slide and you'll be able to stop and read this. And it is also on the government website, so I'm not going to go through this. The most important thing currently, though, is to remember this is a consultation. No existing legal rights have changed yet. We know that some local authorities are already moving towards what they think the new system is going to be and are starting to put things in place. And some of that is because they've been asked to by the DfE, and some of it is because they see opportunities to implement changes now. But all of the existing legislation is still in force, and local authorities and schools must meet all existing legal duties. And if you have any questions or you'd like any advice, support or training, the Down Syndrome Association is here to help. I'm going to stop sharing my screen and stop talking, and I'm going to hand over to Philippa, who hopefully will be able to share her screen.
Thanks, Sharon. And just going to bring up my slides. Hope that's just get onto the correct slide and then we should be ready to roll. Right. Sorry, that's is it not on the correct slide? Thanks, Sharon, and thank you for inviting me to meet you this afternoon and to set out some thoughts that I've had about the white paper, combination of the school's white paper and the consultation document. And just a reminder that I am speaking as an independent advisor. Though I have strong links to the Council for Disabled Children, so I have no idea what they think about what I'd be saying this afternoon. So this is very much my views. My starting point is just to remind you that actually we started talking about the reforms back at the back end of 2019 when we anticipated there'd be a green paper by Christmas. Now, we all know COVID intervened, then a general election. We've had a lot of change since, but we did also have some proposals from the previous government. And some of those proposals have appear in the new proposals under this government. But my point is fundamentally here to point out that actually these documents arrive really kind of like 5.5 years after we were anticipating reforms. And I think the problem there is that by now we have children, more children who are failing, more children with SEN and disabilities who are failing and not achieving well. We have more parents who are angry in turn about that. We have more local authorities who've gone into bankruptcy, who've gone into debt, largely on account of the cost of the reforms. Overall, we're not in a good place to talk constructively about reform, and I think that is likely to colour people's judgment about the proposals here. And I think it doesn't create a good environment for having a really good discussion about the proposals. And I just mention that because I think that understandably, the proposals from the national government are very much focused on the costs of the system and bringing down the costs of the current system. But I want to propose a different question that we all need to ask ourselves about each of the proposals, and I'll do that in just a minute. I want to consider the Children and Families Act framework for special educational needs and special educational provision, and then within that, how we think the schools white paper may actually affect what we want to see generally available in all schools. Then how national inclusion standards and specialist provision packages fit into that Children and Families Act definition. And then a few thoughts about the potential impact on EHCPs and current definitions we have around necessary and specific detail, normally quantified, and how individual we think those packages are going to look, and indeed the national inclusion standards. But fundamentally, I think we need to ask ourselves, will this particular proposal improve outcomes for children and young people? It may or may not be a direct impact, but for example, teacher training, of course, if we get teacher training more broadly based around children with SEN and disabilities than it has been, then we could say, well, yes, not directly necessarily, but indirectly, yes. So I think that's the question we need to ask of each of the proposals. I want to go on then just to think about special educational needs and special educational provision, because I think this lies at the heart of what's proposed here, and perhaps there isn't adequate recognition for me in the proposals of the likely impact. So we compare one child with other children to understand whether they have a special educational need. It's, if you like, it's a twice relative definition. We compare one child with other children, and we compare the provision made generally with that provision which is additional to or different from that which is made generally available. So just to help me with, if you like, laying out where I think there's impact from some of the proposals in the white paper and in the SEN and disability consultation document, I resort to a diagram. It's a diagram of groins at the seaside, and here they are. Here is the tide coming in, and here it is. It's a little bit, the tide is a bit higher here, and the tide is a bit higher again here. Here it's lower again. Now I'm using that to represent the generally available provision. So as the tide rises, generally available provision is better. That might be more funding, it might be better curriculum differentiation, it might be teacher training. Some of these things can raise the level of the tide, improve what is generally available. And then above the tide, we have children who, in addition, need individual provision to be made for them. Picture seaside has seagulls inevitably, and you need to watch out for them. Right, so we have generally available provision within the tide, and we have additional to or different from, which requires us to intervene individually for those children in order to ensure that their needs are met. There is an equivalent relationship set out in the United Nations Convention on the Rights of People with Disabilities. So there is reasonable accommodation for children and young people and indeed adults in this UN Convention. But that sits on top of universal design. And the UN Convention is very clear about the benefit of enhancing the universal design to the greatest extent possible without the need for adaptation or specialised design. And I think that's important, and that's an important thing that the government is attempting to do in the Schools White Paper. So we've got generally available, under the tide, and universal design, and above the tide we need to intervene more individually to make reasonable accommodations, or in the Equality Act, reasonable adjustments or additional to or different from provision. So my question is, how do we then raise the tide, and do the proposals, particularly the proposals in the Schools White Paper, how do those help to raise the tide to meet a greater number of children's needs from the generally available provision? So let's have a little look at that. And I think there's a lot there, and it's not just stuff that's in the white paper, it's stuff that's already happening. So it's important to recognize that. And my question to you would be, does a combination of what's already happening, the curriculum is already being revised, does a combination of what's already happening and what's in the white paper, do they in combination help to raise the tide? And where they don't go far enough to raise the tide, what would we need to do? So, for example, is the 2028 curriculum a curriculum for all? Is there sufficient breadth and enrichment for all children? I know that's in the hands of all the subject specialists at the minute. So are we confident that actually that is going to lead to a curriculum which is better designed for all children and young people? Do our assessment systems currently reflect the progress for all? Well, no, they don't. But then Progress 8 is under review. Does that go far enough? And in my view, no. So it depends a little bit what assessment is made below the level at which we will assess for all children. Teacher training. I have a question about the teacher standards. Do those teacher standards, particularly the adaptive teaching standard, do they move too swiftly to adaptive teaching? That we refer to the SENCO or specialist advisors too quickly? Or should we have more focus on that specialist support being within the curriculum? So with curriculum specialists, the coordinators or the heads of department in our schools. On behaviour policies, there is a lot about belonging in schools, which is largely in the context of reducing the number of children who are not in school or who are not attending, meeting the attendance criteria. Are we going far enough with belonging and relational approaches, or are they just couched in terms of attendance? Because if they stop with attendance, that I fear they will fail. So do they go far enough? Then the accountability. The new framework is a much clearer focus on inclusion. Again, how is that playing out in inspections? Do we have enough inspections already to know whether that's working and working well? And what do we need to learn from the implementation of the new framework? What about values and ethos? How are our hearts and minds going to be changed? Because this does require that, doesn't it? If we're going to have more children included in school, we know that lots of children get turned away when parents go and visit a school before they even get to the sort of statutory framework around admissions. And children are encouraged to, there's a very good school down the road where there's excellent SENCO who really understands your child's needs. That's a real risk if we don't change hearts and minds, if we don't really ensure that everyone is behind this idea that all children should be in our mainstream schools and should be learning, developing, and achieving well. So let's go on then. Let's look at the SEND reforms in a little bit more detail then. Now, the national inclusion standards being formulated by national experts and with a focus on continual professional development. Question, do those really feed into teacher experiences? And if so, how? And do we think that evidence-based approach, which we're exhorted to use, and absolutely quite rightly, but where does the expertise sit around that evidence? And to what extent do we make sure that teachers in classrooms are actually using the evidence of their eyes and developing their professional curiosity where children are not learning and developing as they should? I think there's a risk that this expertise is located too far away from the classroom for me. So do we think this will actually work if those standards, those evidence-based standards, are subject to that continual professional development process? Or do we need to ensure that it is better built into the core teacher training and more clearly focused on what teachers see and understand in classrooms on a daily basis? Do those 4 broad areas of need at the moment becoming 5 areas of development, does that help teachers? Is this really in the language that teachers understand? And we have those experts at hand. We've had a significant erosion of all those specialist support services that schools used to benefit from. It's never envisaged that schools would be able to deliver all of this on their own account. So do we have a good workforce strategy around this that's going to ensure that all teachers coming into the system are well trained in understanding SEN and disability, as well as helping children to get into our top universities, which has been very much the focus of the previous government? Are we confident that a workforce strategy in place to ensure that there will be those people in the local authority services or supporting MATs? And how about this idea that those individual support plans, which we used to have before the Children and Families Act, we had individual education plans. We lost those with the Code of Practice under the Children and Families Act. If we make those statutory, does that enhance the capacity of schools to work collaboratively and creatively with parents? I think that's a question we need to think about. Is that the right approach? No problem in making sure we have individual plans, but making them statutory, does that create that kind of tribunal type relationship with schools, which are going to be deeply, deeply unhelpful if we really need the creativity of parents and teachers working together? And would a complaints process actually help? It may well hinder an enhanced complaints process. A little bit of me says that perhaps the current proposals don't take sufficient account of what's in place already. There's no acknowledgement, there's plenty of acknowledgement of reasonable adjustments, no acknowledgements of the requirements on all schools to have an accessibility plan. And so how does an inclusion strategy fit in with an accessibility plan? It looks as if it's very much focused on funding, but there's no clear relationship, and I think that's an omission. The government sets out their aspirations for every child. Now, a question, do we think these are the right aspirations? Of course, they are in and of themselves. They are good, they are positive, they are long-term, but are they enough? And I think we need to ask ourselves that question. I'm not going through the detail of this because, as Sharon says, you pick it up on the recording, and the slide will be there for you to refer to. But those are the ambitions and the targets that the government has set. So, are those ambitions and are those targets sufficiently inclusive in and of themselves? And do we need to have more in here about the Equality Act duties? Where is the focus on ordinarily available provision as well? That is required under the SEN and disability regulations to be agreed with the local authority by all local providers. Now, that provides an opportunity to have a really significant and collaborative approach, including parents in that local level of discussion about what's working, what we should expect all schools in the local area to work on. Now, should our national inclusion standards draw on some of that and be advisory rather than statutory? If they're included in the code of practice, effectively they become statutory. Yet our evidence base really tells us that we need good school leadership, we need good teacher training, we need good classroom practice. We don't have anything more detailed than that, and I don't think national inclusion standards really that I don't think that's what the government means by national inclusion standards. That's our evidence base at the moment. If we go to the EEF databases and all the work that they've done, from that emerges a set of principles for schools. That, of course, should be in the code of practice, no question. But that research and evidence that's gradually being gathered, and not least through the EEF work, is something that needs to be on a tighter time scale than a code of practice. And I think we do need to have some thought about where we think evidence exists and acknowledge the enormous evidence that is held by skilled classroom teachers. So will these proposals improve outcomes? What needs to be done what further needs to be done to improve the universal offer and the generally available provision? I do think that the proposals change the definition of special educational needs and decisions about entitlement to an EHCP, and I don't see the evidence that being thought through carefully enough. Here is it back to the diagram again. My concern is that the specialist provision packages don't necessarily sit coherently against the level of the tide, which will be determined by those national inclusion standards. If we're defining the specialist provision packages as being for children with complex needs, my view is that there is a risk that that line, the tide mark, if you like, could lead to gaps. So we could find ourselves that national inclusion standards support to a particular level, but then there is a gap before a child has sufficiently complex needs to warrant a specialist package. So it's whether the child meets the new threshold for specialist provision, and it's for children and young people with the most complex needs. This line is not defined by needs, you notice, it's defined by provision. Provision that is generally available, or provision that is additional to or different from that which is generally available. The risk, in my view, is that we will have a gap because we're defining that line, the eligibility for specialist provision packages, by complexity of need, and the national inclusion standards by provision. So there is that risk. The other risk here is that children's needs grow as they are unmet. So you may have a need which is not met from the provision set out in the national inclusion standards, however that's done, however evidence-based. You may have a gap before a child's needs are considered sufficiently complex. And during that time, how are they going to be provided for? So the risk of a gap. Do we think that the expert panel is sufficiently equipped to really work with teachers about how these inclusion standards are going to work out in classrooms, and where we think that expertise needs to lie, where the evidence lies? I think we need to think we need to think carefully about how that can be identified from afar, if you like. If this is meant to be individual provision, isn't it? Meant to be individual provision, and it's Phillipson the other day saying mums and dads are fed up with the faceless soul system that governs what their child gets and how. Now, how are we individualizing that when we are handing it to this panel of experts who are going to dictate nationally? How will that take account of local context? How will that take account of the different levels of need across the new areas of development? I think there is a level of complexity in determining those inclusion standards and the specialist provision packages, which doesn't seem to be recognised in the way that the proposals are set out. That I think I've said all of that already. Where is the expertise and in terms of how this is going to be delivered? And where are teachers in that mix as well? That's all discussed between experts and parents, but it's that creative conversation with teachers that often leads to the best provision. Even as a draft, the specialist provision packages really doesn't talk about provision at all, except in one instance where they refer to specialist teachers. And in that particular instance, it's specialist teachers of children with visual impairment or hearing impairment. That, to me, doesn't reflect a proper understanding of how the system works at the moment, because most children with a hearing impairment or vision impairment are included in mainstream provision without the need for any EHCP. Yet this is within the specialist packages that you'll have to have an EHCP to get one of these specialist packages. Yet those children are included in mainstream schools without the need for an EHCP, the vast majority of them. So if we have these specialist provision packages, what happens to that definition of necessary in the code of practice? Well, it's in the legislation as well. A child warrants an EHCP if it is necessary, and then necessary is set out in the code of practice to help us understand. That links to the nature of the provision to be made to meet the needs. Doesn't relate to the complexity of need. It relates to the provision to be made to meet the need. And that it takes me back to my point about, are we talking about provision and what provision is needed, or are we talking about needs? And there are real risks if we start to define things in terms of needs. Okay, and then we have that definition around specific, detailed, and quantified, and that's normally quantified, and that would seem to disappear if we had specialist packages, because there's no way that could be specific, detailed, and quantified. Why have we got that specific, detailed, and normally quantified bit in the code of practice? Because for so long, children have not had the specificity to know, for a parent to know whether their child is getting the provision that they're supposed to be getting. So there are some problems, I think, with seeing how the proposals relate to the definition of special educational needs and special educational provision that we have. And I think it would be unwise to try to redefine. Those are the definitions we've had since the day that we had legislation covering the provision for children with special educational needs in the 1981 Act. That's the first way in which it's set out there. So I would be very concerned if there were any proposal to redefine, and yet the current proposals don't seem to recognise the definition that we have. So some more thoughts there, some questions. Will these proposals improve outcomes for children and young people? Are the right people involved, but either in implementing the proposals or in contributing to their development? Where do we need the experts? How do we position the evidence in order to have impact? And just a reminder that generally available, the additional to or different from, and the line in between. So, apologies, I've gone on longer than I should have done, but thank you very much. Thank you very much for listening.
Philippa, thank you so much. And I've got a question. There's one question coming from Anna, which I'm going to read out. But if anybody else has any other questions, please do put them into the Q&A. So Anna has said what she doesn't understand is why they are retaining the name of an education, health and care plan when
Mm.
what seems to be being proposed is a repeal of what we currently have and what we currently understand to be an education, health and care plan. Do you have any thoughts on that?
Well, my starting question is whether the people who've drafted the proposals fully understand the impact of the proposals on an EHCP, because we very casually talk throughout the consultation document about an EHCP as if it were going to continue to be the same thing. And for example, the review of an EHCP annually. Well, when schools have created, and lots of schools still have individual education plans anyway, those are normally thought of as being reviewed once a term at the very least. So there is another impact from some of the other process in terms of review. And I think it may be the government's intention that the EHCP essentially remains the same, but that the threshold for that changes. My view is that we should, in all honesty, if we want more inclusive schools and we want better provision for all children in our mainstream schools, we need to look to the white paper to do that. All the plans in the white paper are very, very focused on those things which will increase the level of the tide. And that in and of itself should reduce the need for an EHCP. My clear preference, and others will have a different view. My clear preference is that we should not seek to change the threshold for an EHCP. We should not seek to change the review of a period for an EHCP. That we should, if we need to make that individual provision, we should define it individually and we should review it individually as children's needs change. Not just as children's needs change, but as the demands of education change. We start to ask children to do more complex things. We need to have in mind not just the child, but the system with which they're interacting and the way that changes. So I am very reluctant to see any real legal changes to an EHCP and the requirements that sit around it, because I genuinely believe that if we can change that threshold by increasing the quality of the provision that is made generally available. I'm not saying that's easy, but it's very, very complex. And I've said very clearly, I don't see what's going to change hearts and minds in there. I don't see an articulation of a commitment that there is very much more clearly set out in the white paper, a much clearer commitment to addressing issues of inequality in the system. And I don't see that so clearly in the SEN and disability consultation documents. That's a worry. I think we should really encourage the government to have confidence that with all the improvements they're proposing, don't touch the legal framework, but use that as a criterion for whether what you're doing is proving effective.
I know that we had a focus group discussion just yesterday evening, and some of the people in the room here were there, and we were talking a little about this, that actually what they're suggesting an ISP is actually an EHCP potentially, but with fewer legal rights in terms of accountability, being able to challenge the provision in it through the SEND tribunal, and also that it's moving the potential for conflict to be between parents and schools rather than parents and local authorities. So I don't know if you've got any views on that, Philippa, in terms of the risks of that in relation to, that you talked about the enhanced complaints process, but also the risk for judicial reviews or disability discrimination claims against schools, and how they might be able to handle that and school governors be able to manage that process.
Yes.
Um,
I mean, I think there is a problem because I think it will, if you make it a legal requirement, I think that's problematic. I have absolutely no problem with setting it out more clearly in the code of practice. We used to have individual education plans in the code of practice. Those went in the 2014, 2015 codes of practice. However, I mean, I specifically worked with the DfE to try and get some wording that would make it clear that it was expected that schools would make a note of discussions with parents about the nature of the child's needs, the provision that would be need to be made for them, and how that would be kept under review, which in effect is, if you like, is a very basic individual education plan, or
yeah,
sorry, it's support plan, not an education plan, because I think that's a bit
yes,
of a problem. I don't think children need support. I think they need education. Um, so I don't have any problem with putting it into the code of practice. This should be written down, shared with parents, and we can call it what you like, but we need to be clear that should be done. Lots of schools still do it anyway, because that's how they keep track of whether a child is making progress or not, and whether what they're doing is working. So I think subjecting it to that legal test, if you like, is not helpful to the nature of the relationship, which is the very thing that actually helps teachers and parents to work creatively together. You need that. The minute it becomes adversarial, any creativity flies out of the window. And we
mhm,
know from some of the research when, I mean, a similar problem in the late noughties when very significant increase in the number of statements that were in place, um, and work or research on reducing the need for a statement was a piece of
yeah,
research which was done by Anne Pinney, showed that highlighted the importance of that early collaborative relationship, which even if subsequently you went to tribunal, parents went to tribunal about provision for their child, actually that relationship continued to support the process, even
yeah,
through to tribunal. Now, if you lose that collaborative process, you lose any possibility of securing some provision that we'd be confident would work. It really needs to be agreed by teachers, and teachers need to be able to say, look, I couldn't do what you're suggesting because it simply wouldn't work in my classroom. Is there
mm,
another way that we could do it? And if you don't have those conversations going on, and if
yeah,
it's not supported by a locally agreed, what's often called ordinarily available provision, it's required in the regs. That is a really, really helpful framework for having that conversation at a local level where effectively schools are all signing up to saying, yeah, it's absolutely okay. We should be expected to be able to do that for any child who needs it. And then you
yeah,
stop focusing on the level of need and you start to think about the provision that actually, do you know there's some other kids who would benefit from this approach? and
absolutely.
and you actually can do some more work that you might consider to be more preventive because you've
Yeah.
spotted something that's going to help one kid, it's likely to help some other kids as well.
We again in the focus group last night, we talked about how Makaton can help so many children in a classroom. But when you start allocating that to just one child, in an EHCP or an ISP or whatever you want to call it. And it ends up then just following that child rather than it being that whole school. So absolutely. I've got a couple of other questions and I'm very conscious of time because we've gone over 5 o'clock. So if I can put these to you, Philippa, and then we'll draw the session to a close. But I would like to remind people that they can email me at the policy email address, which you can find on the website and also on the slides. So Jeanette has said she's concerned that professionals from other disciplines don't always work in a collaborative manner that's required for inclusion to work. And she just wondered whether the government, and obviously I know you're not the government, but what your thoughts might be around actually bringing speech and language therapists, OTs, physios as within that education umbrella rather than maybe under that health umbrella, because
Mm.
that can be sometimes where some of the challenges are, where maybe that health provision isn't available locally. And I know this is what the expert at hands is meant to be partially or maybe fully addressing, but just wondered your thoughts on that, Philippa.
Yeah, I would look to that experts at hand proposal for some of that because I think I absolutely take the point that other professions and other agencies may not see themselves as being drawn into the schools framework so readily as it is sort of envisaged by that experts at hand thing. But I think there are some missing proposals there as well. I notice there's nothing about specialist speech, language and communication teachers. We do have teachers who are specifically trained around speech, language, and communication, and they often work with speech and language therapists, but actually they are in a very well placed to help schools with much more of an understanding of the educational framework, to think about how actually you can do this in a whole class or a whole school way. And I think that is sort of it's finding that framework which doesn't go straight to speech and language therapists or straight to any other provision. I mean, occupational therapists, physiotherapists, but where you've got some kind of tiered approach to those experts at hand, which is why I say we really do need some kind of workforce development strategy nationally to make sure that we are training, recruiting, and deploying those staff in the right way at the right level. I think that the problem is that many agencies, and particularly health agencies, are really focused on that individual treatment, if you like.
Yes.
And these proposals try to break away from that idea of a diagnosis, which sometimes takes you to that individual treatment. So actually, we need to find a layer under that, which is informed both by the education framework and by that specialist health framework. It's not the case everywhere, and in some places I've been involved in developing local, ordinarily available provision, and other agencies have got very readily involved in that. And some of them have said, look, actually, there are a lot of things that schools can do, but without us being involved, but there are quite a lot of things that we need to be able to help them with because it
Mhm.
does need some specialist input. And in one local authority, one of the specialist support services said to me, look, there's a school I know which picks up the phone when a child sneezes, wants specialist input from the physiotherapy department when effectively when a child sneezes. There are other schools who actually persevere for too long. And
Uh,
that's why we need to have this local discussion about when it's appropriate to call on us and when actually this is something you can do on your own or
yeah.
when you can do with a bit of input from us. So it's really trying to get that tiered in the same way. And I think that's underlies Jeanette's question there. Um,
Yeah. So there needs to be some clear guidance about when those expert hands are brought in, when schools should be just able to do and
yeah,
support
but I mean,
children's
my
needs.
view is that it has to take account of local context.
Yeah, absolutely. Um,
And that doesn't seem to be there in the idea of national inclusion standards. perfect idea. Who wouldn't want
Yeah,
national inclusion standards? I
absolutely.
do think they have to be
That
worked
local
out locally.
application.
Yeah.
Yeah. And then the very last question, and again, you may not know the answer to this, but if you have a view on it, and then we will draw the session to a close. Jeanette has said, will there be more SEN awareness in subject specialist training for teachers? So I guess again, I was in another meeting this morning and this came up around how often at secondary school and you have, say, for example, a geography teacher or a history teacher, they might not be as exposed as other teachers to that sort of SEND specific training or how to support
Mm.
students to engage with that subject, for example, and how to
Yeah.
adapt that subject. So I
Yeah.
don't know if you just have any broad thoughts on that.
Yes, and this is one of my areas of a bit of passion because we've got some very good research that says that the best inclusive practice in mainstream classrooms is where that I mean there are about 10 different factors, but the two that really leap off the page to me in this research are one, that teachers have such a detailed depth, breadth, and detail in their understanding of their curriculum, by which I mean what they are charged with teaching in their classroom, that they know where every single child in their classroom is within that curriculum framework.
Mhm.
And combined with that, that teacher then engages with a pedagogic community, which helps them to constantly keep the evidence of their own eyes under review. So the
Yeah.
ability to say, hold on a minute, this child couldn't do that, but yet he could do this. Now, I thought he'd have to do that initial step before he'd be able to do this step, but he's he hasn't mastered that. What I thought was an earlier step. So constantly keeping that under review. And I think that's where we perhaps have the greatest area for improvement nationally, that we do actually do more of that adaptive approach or curriculum differentiation within our core subject teaching,
Yeah.
teacher training. And I think if we don't do that, we're actually not really going to progress because we will move out of the classroom to consult the SENCO or the specialists that the teacher standards refer
Mhm.
to without having thoroughly explored within our own curriculum area. And I
Yeah.
think that's so I would very much want to see that as part of the approach, really covered by the white paper, if you like, rather than the SEN. But I think we need to be able to say within the SEN and disability consultation, you need to focus more on developing curriculum for all and ensuring that that is built into teacher training more comprehensively so that we're not seeing things as bolt on, that we're seeing them built in to that curriculum framework.
So great question from Jeanette then, for us to end on. And
Thank you,
Philippa,
Jeanette.
thank you so much for your expertise, your insight. I think you've given me food for thought as well in terms of how the Down Syndrome Association can respond to this consultation. And I know we've already spoken about it and been in the session together, but again, it's just coming to this again fresh this evening. So I would like to say thank you to you. I would like to say thank you to everyone who's come along this evening to this Twilight session for professionals and for those who asked the questions as well. As I've said, this will be put online. You'll have to give us a week or two because our comms team are very busy at the moment, but we will get it online as soon as we possibly can. Just to say, we are running another event on the 6th of May in the evening, which is about the consultation, and we'll be unpicking what maybe some of the questions are asking, or maybe how you might want to approach some of those questions. And just keep in touch with us, is what I would say. You're very welcome to come to that event. We are also running a focus group to look at specifically at post 16 as well. So if any of you are supporting families who have children with Down syndrome who are 14 years plus, that focus group is on the evening of the 5th of May, and we still have some spaces available. And we would love to see some families signing up for that. Those focus groups are actually taking place with a representative from the DFE attending, so they can hear directly from families about the impact of the reforms. So all of the details for all of those things are on our website, on our school's white paper page. So thank you all very much for this evening, and please go and enjoy the rest of your evenings. It's a beautiful day here, so I hope it is there for all of you, and you can have a good evening. Thank you.